Hi, I'm Molly Sullivan with Golfers MD, your source for all your golf health, fitness, and injury information. Golfers typically don't get shoulder fractures, but it can happen off the course. Shoulder fractures are partial breaks to either the clavicle or the neck of the humerus. It generally is from impact injuries such as a fall or blow to the shoulder. The pain and injury can often cause golfers limited mobility and misplay. Today we visit with Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about shoulder fractures.
Fractures of the humerus or the arm bone occur typically with blunt injuries or falls on outstretched arms. It can rarely occur in throwers or overhead athletes with just the throwing motion. Symptoms of a fracture basically center around pain, the inability to use the arm, swelling, and occasionally some degree of tingling or numbness down the arm if sufficient swelling causes those symptoms. The treatment for a humerus fracture depends on the degree of the injury as well as what portion of the bone that has been injured. Occasionally, if the bone is not significantly damaged or displaced where the pieces of the bone are separated, you can be treated with a sling to allow the bones to start healing, and when sufficient healing has occurred, referral to a physical therapist to recover the motion and the strength will help return the athlete to function. If the pieces of the bone are significantly moved or the position of the bone itself is in the wrong position, then surgery is used to correct that position, hold the bones together, and allow healing to complete itself. The athlete with a proximal humerus fracture or humerus fracture will have to wait till the bone is completely healed to withstand either the contact stresses of an impact-related sport or the torsional or whipping stresses on the bone in a throwing or racket sport.
Rehabilitation of a shoulder fracture is really rehabilitation of a stiff and painful shoulder. The shoulder has to be immobilized to allow the bone to heal, and usually it's the humerus, this bone, that is fractured up in the head part of it and the neck. The length of time that it's immobilized is going to cause the joint to basically be stiff and painful. So in order for you to get back, the rehab time is going to be at least 4 to 6 weeks, possibly longer if you have a tendency to stiffen up more than other people do. That is called a frozen shoulder or adhesive capsulitis. Manual therapy, which is hands-on, moving the joints at the joint surfaces, strengthening exercises, and then low, prolonged stretch. 3 important things to do to get that shoulder back.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with GolfersMD.com. Remember, at GolfersMD, health equals performance.